Ladies and gentlemen, members of City Council, please attend the call meeting of the City Council to be held in the 6th floor conference room, 801 Crawford Street, 5 p.m., Tuesday, June 14, 2016, for the purpose of a public work session. In addition, you may consider a motion to go into closed meeting by order of the mayor. Mr. Cherry.
Here.
Dr. Edmonds.
Here.
Mr. Meeks. Mr. Moody. Ms. Simmons.
Here.
Dr. Whitaker.
Present.
Mayor Wright.
Here.
Dr. Patton.
Okay. Mayor, Vice Mayor, and members of City Council, I will begin our public work session this evening with the introduction of our newest member who joined our team on June 1st, Mr. Vincent E. Jones, Deputy City Manager. Mr. Jones comes to us from the City of Richmond, having served there as Deputy Council Chief of Staff for nearly 4 years. Mr. Jones brings 16 years of public sector, state, and municipal government experience. He's a graduate of the College of William and Mary, earning his bachelor's degree, and a graduate of Florida State University, earning his master's degree. His extensive public sector knowledge, effectiveness in establishing value-based professional relationships, commitment to improving customer services, and ability to provide collaborative conflict resolution and leadership will make him a great asset for the new Portsmouth. Please welcome Mr. Jones.
Thank you.
During this evening's public work session, we have 3 presentations. Our first presentation will be given by our CFO, Mrs. Alice Kelly. She will present an update on the results of the recommendations implemented to improve the city's golf course operations. Last June, City Council was presented an update on the Golf Fund with strategies to help improve operations and financial results. This presentation is a follow-up with operational and financial status of the Golf Fund. The second presentation will be given by Mr. David Chang, Health Director of the Portsmouth Health Department. Mr. Chang will present a report on the status of health in Portsmouth. As both a physician and a public health professional, Mr. Chang will discuss the importance of looking beyond the medical profession to improve our health and how we can all work together to create a community of health in Portsmouth. The third presentation and final for this evening will also be presented by Dr. Chang. One of the major health concerns this summer across the nation and the world is the local transmission of Zika virus in the United States and abroad. Health professionals and Virginia Department of Health have been working for the last several months to prepare our communities for the mosquito season. Despite all that has been on television regarding Zika, studies show that the majority of people say they know little or nothing about it. Today, Mr. Chang will update our community and provide a short summary of what Zika virus is, how it is spread, what we are doing as a city to prepare for the mosquito season, and what we can do all as individuals to protect ourselves. We'll start with Mrs. Kelly and then Dr. Chang.
Good afternoon. Oh, good evening. Good evening. I'm here to talk about the Golf Fund, and I wanted to also recognize Mark Furlow, who helped me with a lot of the presentation. The national golf trends, when I started this presentation, I looked on the internet and I saw a lot of different articles on golf. 4, no, make that 5 golf reasons golf is in the hole, the death of golf, why golf is in decline. And one of the things that I had read back in December in Governing Magazine is that municipal courses are having a hard time, which presents a conundrum for cities that house them. And some reasons that experts state that golf is in a decline are the expense, the time commitment, and lack of a champion in the golf sport. The National Golf Foundation states that in 2015, the United States had 14,000 open and operating golf courses. In 2015, 17 new courses opened and 177 were closed. 2016 outlook is about the same, where 15 to 25 are opening, but over 150 to 175 probably will close. And according to the National Golf Foundation, the number of golfers in the United States has declined from 30 million in 2030 to 24 million in 2015, which is about a 22% decline. However, Some experts have said the downturn in golf's popularity is like any other sport. There's a natural ebb and flow of the sport, and it's always been expensive. In the 1600s, a golf ball was about $14 in today's equivalent. Golf didn't just suddenly become hard. It's always been hard, and that's kind of the passion that people have for it, is how hard and difficult it is to get that little ball in the hole, and that when the sport has champions, the popularity increases. In the 1930, golf popularity soared with Bobby Jones. In the 1950, we had Arnold Palmer, Curtis Strange in the late 80s, early 90s, and Tiger Woods was obviously a very big golfer and a big champion. And his last championship was in 2008, so it's been a while since we've had a big champion. Other sports, Gabby Douglas in gymnastics. My nieces went to take gymnastics because of Gabby Douglas. We have Serena and Venus Williams, Muhammad Ali, Cam Newtown in football, and Kobe Bryant in basketball. Another thing about golf is, since the first time in 112 years, golf is going to be in the Olympics in Rio de Janeiro this summer. And I think the Golf Foundation is saying that more kids now will see golf and have some interest in that. The other issue is that the golf president has said that since the first time since 2012, the rounds of golf have increased about 2%. So it could possibly be on the uptick. Baby boomers are retiring, the economy is improving, and the Olympics might give it a little bit more push. And so that should all have a positive impact on the number of rounds played. So as an overall, that's kind of the national background of golf.
Good history lesson.
I had to learn a little bit more about golf than I knew already. Some of the benefits of a city-owned golf course is that it generates revenue to the local economy, enhances livability, increases the day trippers and tourism and visitors to the city, enables fundraising and partnerships with local organizations, can have sustainability and green initiative improvements. And also, municipalities can control the quality of the course. And one of the things that our golf course has been named as one of the best municipal golf courses in the United States, and part of that is because we control the quality of it. We also enhance the accessibility and the inclusiveness of a golf. So it's not always about the numbers, it's also about the positive social, economic, and community impacts. This slide shows, it's a little bit old, but it shows in 2012 there was a tourism impact of $1.3 billion to the state of Virginia, which obviously Portsmouth benefited from having 2 golf courses. The next slide shows some of the community fundraising that we've done and have had organizations use the Bite a Weed course to help raise funds in the city. The percentage of users for the course is about 50-50 split, which is what we really want. There's no wrong ratio here. We want residents to be able to utilize our course, but we also want non-residents to be coming into our city and keeping their tax dollars here. So it's a good split between residents and non-residents. What I'd like to talk a little bit about is the budget comparison. And in 2015, the actual revenues were about $1.2 million, and we're on projection in 2016 to have about the same amount of revenue. We, in our 17 budget, put a budget of $1.5 million, and we do think we can increase our revenues. The major news is that we were able to decrease expenses substantially from an actual of 2.7 or 2.69 in 2015 to a projection of 2.1 for 2016.
How do we do that?
And we'll get to that. That was the suggestions from last year, and we've done a lot of the improvements to that. One of the things, though, I did want to also talk about is a subsidy, that the city is subsidizing mostly the debt and the pension liabilities in 2017, and we have a slight operating loss in 2017, which we're trying to bring down to a 0 operating loss.
So if we're going from 2.6 down to 2.1, so somewhere this new model we adopted last time
There's
$500,000.
a lot of working in there, yes. I also wanted to talk about the 5-year financial comparison. In 2014, we had an unrestricted deficit of $890,000. And so in the past 5 years, we've had deficits in the Gulf Fund. In 2015, GASB 68, which is the accounting standard for pensions, required us to book pension liabilities in 1 year. So you don't see it on your income statement, but you see it on your unrestricted deficit. It went up $1 million, and that is a long-term liability that we have to pay for pensions. Pensions are also based on salaries, and because we reduced salaries in our Gulf Fund, that will go down in the next year. It's just always a year behind. And so I wanted to point out that deficit. Some of it's operating loss, but the majority of it is for long-term liabilities. And so when you look at deficits in financial statements, especially for a fund like the Gulf Fund, we have long-term liabilities on our books, but we don't have the cash assets to pay them immediately. So it looks like you have a large deficit, but basically it doesn't really indicate that you can't be sustainable financially. It indicates that you're just not going to pay them immediately. And so because we do a pay-as-you-go for liabilities, the liabilities will be paid when they become due, and so we have this negative deficit on our books. Some of that is our operating loss, but some of it is also very major liabilities for debt and pension. The strategies that we implemented in FY 2015 that the mayor talked about is that we had the presentation last year, and we implemented these plans to improve the Gulf Fund financially. We have a new pricing strategy in place. We have flexibility in pricing. We're using prepaid gift certificates. The expense reductions are reduction in full-time staff. We've contracted for labor-intensive tasks, and we are allowing outside caterers. We have an ongoing marketing plan expansion, website update. We are still working on getting online registration for our golf, and we're expanding into other potential markets, especially youth and more tournaments. And so we do believe that that has really resulted in a lot of the reduction in the expenses. The next slide shows the number of rounds for our Bite-A-Wee course, and it goes up and down based on the weather, the month, the coldness, and some months are higher and lower just depending on the number of days, the number of weekends in each month. One of the things that I've been talking to a lot of golfers about Bite-A-Wee. They like that course because it has a really good layout. It's compact, but it's challenging, and it's good for new players, but also players that might be up in years that need a smaller course to use. Our city park, also we have the number of rounds in the city park.
Is that both or?
No, this is city park.
The other slide?
Sure.
What explains the drop there in May? I know we're still in June, but the May one.
Remember, May rained every day.
We had 18 days of rain.
May was, and that's what so it's hard to compare apples to apples sometimes with this. So overall, some of the winter months were a little bit warmer.
It was 18 days. I was
Sure. But we are looking at the statistics of all of this now much more carefully than we've ever had in the past. So this is City Park, which is a 9-hole park, and our next slide. Whoops. The next slide is our city rates, and one of the things that the study that we had suggested is making sure we keep golfers moving. So we have carts rates at $5 a cart rental, and our prices are very competitive with courses throughout the city. Throughout the region. And so we have, obviously, twilight after 2 p.m. I went out to the golf course this afternoon just to get myself in mind of doing golf, and it looked so beautiful out there. I almost just went to golf, and it was after 2 o'clock. I knew it was going to be less expensive, and people looked like they were having fun out there. One of the things that I hadn't really noticed was the pavilion, and we went from having about 10 events last year to about 50 events this year. So we were really selling that pavilion. It's a very nice venue. I hadn't really noticed it before. I'd been out there and played golf at Bite-A-Wee, but I had never really noticed the pavilion before. So our future actions is that we are trying to, in 2017, operate with a small operating loss and get that down to almost a zero operating loss. The city does subsidize the debt and pension liability, but that could be offset by positive economic impacts. We're trying to do much more monthly analysis and tracking. We are trying to work to increase golf rounds through marketing and tournaments, and we are continuing to monitor overall golf trends throughout the nation. Hopefully the Olympics will spur on a little bit more interest in golf. Any questions?
Dr. Wood, can you go back to page 9, the budget
Sure.
comparison?
Yep, I'm sorry.
For the 2017 budget, how are you coming to an operating loss of $43,509? And well, for the subsidy, that's from who?
The subsidies from the city.
Okay.
And if you assume the city's covering the debt and pension, then the operating loss is 143. I mean, really the loss is 843,000. You're right. But the operating loss, if you take out those long-term liabilities and investment into the golf course, it is 143.
Because your subsidy plus your revenues
Equals your expenses.
That's equal your expenses.
Right.
So therefore, we're at more than a $143,000.
That's the operating loss, but the whole loss, to make it even, is 843.
What was the original price tag on the pavilion and all that? Was it somewhere around about $8 million?
We issued bonds for about $9 million in the 1990s, 1998.
And that debt structure that we're still paying on that is what's baked into this number here?
Yes,
It's really
yes.
not fair to assign that to the golf fund, but that's the way it was
All that money
done.
wasn't spent on the golf course.
All that money wasn't spent on the golf
That's how it
course.
was
but-
set up.
Sure.
And that's the way they set it up back then, which is very unfortunate, but we are where we
Yeah,
are.
it's really not about golf balls.
Right.
So the 700,000, that's not all golf.
No, that's part of that $9 million that somebody went out and pavilion renovation and a whole lot of other things and packaged it all in under this.
Sure, it was $9.7 million
9.7.
issued in 1998. And it was for work at City Park, improvement at Bidawee, and some reserve. And we owe about $5,010,000 at the end of 2016 on that debt.
How much?
$5,010,000.
About halfway. Okay.
We did refinance that at a lower interest rate a few
Yeah, I was
years
going to
ago.
say the other day, right.
Yeah.
Are you done, Doc? Yeah. What is it? Our total rounds of golf, I know you got it broken down here, it's about a month, but we got a statistic last year that showed that it was increasing, and that this year's projection that our total rounds would be increasing. Is that,
And it's not holding true. It
is
has
not
decreased
holding
slightly. Yes, it's about 24 versus 26 last year. And some of that could just be the weather. So it's holding even. And Mark, you might want to.
Yeah, I think the big thing we're hearing is that the rain, the significant amount of rain that we've gotten this year has really impacted that, and that's going to be the case every year. We're a weather dependent sport.
Yeah, May is the prime golf. It's golf day, national golf. I learned more about golf doing this presentation. And really, May was just such a rainy, and that's not unusual throughout the region with the rain that we
well, the
had.
numbers were down in some of the other localities, and
Right.
numbers were up last year, and I had a conversation with Mayor Sessoms about a month ago, and I think I called you and asked what was our year-to-date rounds.
I think you did.
Because their numbers were way down, and they were trying
Right.
to figure out
Right.
what's going on.
I mean, I think
here.
there's a national trend too. I mean, you have to look at the national and how many people are playing golf versus how many rainy days you have too. So it's kind of a, and you know, the articles I've read and really it's interesting. Golf comes into a lot of things. I was reading an article on pension and they were investing in a golf course, so I started reading about golf there. But it's really, it ebbs and flows, and it's like any sport. If you have a national hero, people get more interested and get more into playing it.
Those rounds include the rounds for like the Tidewater Youth Golf Association, those associations,
Yes.
those youth groups, are they included in that?
I think they are, yes.
You're referring to the tournaments, the nonprofit organizations, or you?
Right.
Yeah, all
In
those
total.
rounds are included in there.
Okay.
And one of the things that, well, I say that we're investing in a new software out there. The software that we're using right now is a little bit antiquated, so we're looking at new software for all the Parks and Recreation functions to better track those numbers. But those are the best numbers we have.
Yeah, if we could some date in the future for those type of organizations, just see what the
To pull
utilization
those
rate
out.
is. For those groups, a lot of those groups have young golfers, they have minority golfers, and just see what they're doing and how much golf they're playing.
Okay.
Actually, that number was supposed to have been increasing last year. That was one of the selling points with this new motto, is us going out and getting more young kids out there utilizing that course. And
Well, that's why I asked, because I've talked to some of those groups about, and I know they're using it. I just don't know if they're really using it more. I was with some of them this Saturday before last. That a couple of my friends work with the program. So just at some point in time, we just get a snapshot of what that is.
Sure.
I want to go back to the model that we adopted last year, and you look at the expenses, and the expenses are down about $500,000. But overall, talk to me about how that whole thing is going with the vendor that we have over there and all of the offerings that they have, with the number of, how many events you say we had last year?
We had 50 events
50 events
versus,
as opposed to
I think it was 10 or 11 the
10
year
or
before.
11 last year. Is that going the way we expect, and are we going to continue that this year? Do we want 100 events there, Mark? I mean,
Yeah, we definitely, the more tournaments, the better, because those are guaranteed players, and we are dependent. That relationship that we have with the contractor is symbiotic with the golf course. The two entities have to work together to do well and to survive. Because if we can't provide good catering to these tournaments, then they're not going to want to come back. And if if we're not bringing tournaments in for that caterer, he's not going to make money. So both organizations.
About the pavilion piece, because that's
Right.
the unfortunate bogey that's been hung in here under this golf piece, and now we're utilizing that more. We're having more activities, weddings, and all of those types of things. How's that going? And is 50 enough, Lavoris? I mean, what is the
Love to
number?
have
I don't know.
100. I mean,
we
I don't think there's
recognized last year.
as many as we can get.
Yeah, I know.
Yeah.
But hold it. Last year, we realized we had all of this asset sitting over there, and no damn body was using it.
Okay.
Okay?
Okay.
So we say, let's start using it. Let's go bring somebody in so we can increase it. Now, where should we be versus the 50? If it is an aggressive campaign and we did things on our electronic billboard, what should that number be? I mean, yeah, this is great. We went from not using it to having it booking 50 events, but what should we be doing? Something?
I think ideally we're at 100 plus events there. Ideally we're booking it every weekend, both Saturday and Sunday, and then picking up some weekday ones too if we can. But I think 100 is a good target to set. I think that though, even though we're more aggressively marketing the pavilion now than we were, and it's evidenced by the increase in number of rentals. We can still do more. But I think that last year, I think that staff was a little bit more optimistic than what we were able to really accomplish. Especially since we're just starting this big marketing push, we're not hitting the targets that they projected last year. We're just not seeing that yet. We are seeing dramatic increases. Don't get me wrong,
We're hoping
but we're not.
One of the benefits with having these activities that we're bringing more people, and a diverse group of people there. We've got a whole neighborhood out there we're trying to market. That whole Newport area, and we're building, and that whole piece is starting to come back. And how do we capture what the spinoff of that is? And that was the reason why we wanted to go with this new model, bringing more people to that area, so they're driving through that neighborhood and seeing all that development. And somewhere all that comes in together and helps us.
Yeah, and that's another thing I think Al's touched on a little bit, is that you see an increase in home values, and that's not included in the revenue, but that's directly correlated to that golf course being right there in that neighborhood, and the sales tax that people that the city sees on people buying golf balls at Walmart or golf clubs. There's, the sales tax on people eating in our restaurants when they're coming from Virginia Beach to play in our golf course at a tournament. So there's a lot more impact than is actually being captured there in those financial statements. And that's important to remember when you're looking at, you got to look at the whole pie.
That explains why municipalities had golf courses. I mean, you normally want to lose there, but you win on some of the other areas.
Exactly.
So
Right.
that's why we were saying it's unfortunate, Dr. Whitaker, we talked about that pavilion and that $10 million that they lumped on that golf fund, but it is what it is. So we need to start utilizing, getting more people out there, having more events, and seeing what that does to developing and increasing home sales out in the Newport area, and as well as, well, we're talking about the Victory, getting that piece back and seeing what we can do out in that area there. That'll play off of each other as well. So we're going to continue the model, is what I'm
Yes.
hearing,
Yes.
again this year, what we did last year, to see where we are. Okay.
And
I'm sorry. Yeah, Doc.
My only concern with continuing the city ownership of the golf course is that when you go back to the benefits page on page 5, and raised as far as the tax and the golf ball sales, I don't know if we have any data that correlates that with the golf course. That's a lot of
No, and
speculation.
No, you're right. It's not anything that we can directly correlate, but it's something that we know. We know people are buying golf balls at Walmart. Are they using them to play at Elizabeth? What's the ratio that they're using at Bydaways as opposed to the other golf course in the city? I'm not going to mention their name, but we don't know that, and there's no way to correlate that. But we do know that people are playing golf at Bydaway, and they have to get the golf balls somewhere.
Well, I guess the issue that I've raised is, should it be private or publicly owned, and the issues that you've raised, like I said, the correlation, even the tax. I don't know if the taxes would have increased were it not for the golf course, because we've had tax increases. We've had property value, not tax, but property value increases have been experienced across the city. Also on page 5, the benefit that's listed here generates revenue to the local economy, but it's generating it at a loss. If it weren't for the city subsidy, it would be at a loss. So I don't see how that is a benefit to the city. Enhances livability, that's speculative. Increases day tripper, tourism visitors. Do we have data that is correlating that we're having an increase due to people wanting to come to the golf course?
or people who are day trippers, such people coming from out of other places with tournaments. That would be outside of Portsmouth. People
Yeah, about
playing
half of the people that play the golf are outside the city,
Okay.
non-residents. So that was that pie chart.
Right, and so do we have any data showing that those people that are coming here, that they're spending money? To me, it's too much that we are investing that we could put in other areas that would benefit the city, other than a golf course where a significant amount of our citizens don't even participate. And so I just wanted to express that I'm not in agreement with publicly owned golf courses in a city such as this that has so many other issues. So just wanted to.
One of the things we did last year, Dr. Whitaker, and I think Mr. Cherry will back me on this, when we had Ms. Nita Joseph and them look at all three of our golf courses and what we could potentially do with the ownership of them. I don't know when the Suffolk thing expires, because that's a
Next year. That's
a sweet deal that we need to
2017.
hurry up and go away, because that guy's over there getting that golf course for a real sweet deal. But if once we pull that back in and have all three of those golf courses, it was almost, I think one of the models showed we could probably break even. Do you remember that? Depending on the increase in events at the pavilion, as well as the rates that the rounds of golf at Sleepy Hole and the city park, as well as Bydaway were, and we either got a fair market value. I forget what that number is that guy's leasing that Sleepy Hollow
I
for.
think there's ability.
Suffolk. It's not called Sleepy Hollow.
I'm sorry,
Yeah,
Suffolk.
I think
Like 200,000 a year or 50,000. It was something ridiculously
No.
low.
What is it?
It's a stepped lease. This year the payment is 100,000. Next year it goes up to 120,
And then it ends,
and then it ends.
and we tell him goodbye.
That's an option.
All right. Tell him goodbye. Yeah. Okay. What I was trying to explain is once we got that third one back, if we got fair market value over there or work something out, I think there was a possibility that we could break even using all three of them and us doing it instead of taking it and privatizing it, because if you privatize it, the private sector is not going to take that debt that we got on the pavilion. So we're stuck with that. What do you say we owe $5 million, 5.8?
Right,
We're
$5
still
million.
stuck with that. And so how do we make that thing work?
Sure.
And buy time until this lease expires with the Suffolk Golf Course and bring that back into our folds and generate more revenue there. What's that?
You know, we're talking about enhancing accessibility and inclusiveness, and you were talking about the youth groups and whatever. You know, there was a time you gentlemen couldn't play at that course.
We
And,
could.
and, I mean,
Sure.
like Mayor Holly
Sure.
fought hard for that, and it becomes private. That changes. You know,
Sure.
there are lots of citizens. I don't play on the basketball courts. I don't play on the tennis courts. And there are plenty of folks that don't play golf. But I think all of those are things
Amenities.
that we provide to our citizens.
But
you know?
we're not investing $800,000
Well,
into
that's something that
basketball
happened
court.
long before you and I both got here.
Also,
Well, we are investing $800,000.
Also, what you
Look on
speak-
Portsmouth Boulevard.
Yeah, well, what you're speaking to also, and not at the level and not at the amount of investment you're speaking to, we haven't done that. Also, for you to raise the issue of the discrimination that occurs on
I mean,
golf
it's true.
courses, I mean, we that's
It's
not
true.
even, that's a well,
It's
but
true.
that wouldn't that's covered through laws now, so
Yeah,
that's
but it's
not.
still different.
Yeah, well, but that's not a issue.
I just think it's something we do. I think it is part of what a city provides its citizens.
But I
If
think
it's basketball
we were
or
trying to-
swimming or
right.
golf or
we were
whatever.
trying to look at it from the business model.
Yeah,
How do the best
Yeah.
case scenario now with this debt? How do we utilize that and try to make best use out of this thing once we get that other golf course back in Suffolk and try
Right,
to?
and this is part of the full recreation offering of the, for the
That's all I'm
citizens.
saying. Exactly.
And you're right, Mayor. Part of the thought process was, if we're going to do something with a golf course, it should be the one that's not in our city first, and that's the one that's
Right.
that's
One
in
you
Suffolk.
actually make money off of, too.
Yeah, so well, there are a lot of options there. We can make money off of it.
Or sell it to
We
Suffolk.
could sell it and pay the debt off on it. Yeah. So because it's ours and there's no debt on it.
Right.
So we have a lot of options, but they all come into fruition next year when we get
June
that back.
2017.
And we find out where we go from here. But I am pleased with what we heard today. I was pleased with the presentation we got last time. Yeah, we didn't hit all the targets, but just from what I'm seeing, and I occasionally drive out there just to look around myself, and what I'm hearing from the youth groups and everything, a lot of people who are very pleased with the operation out there. The new golf pro, everybody thinks he's great. He's doing a great job, and I've watched him come in to the pavilion when I was at events just to come and check to see what's going on over there. So that's good to know he does that. So I think we drive on, we see where we come out next year this time, and we get the other golf course back,
We get the other
and then
golf
we'll make some hard decisions then.
I mean, it's improving, and so it's
Well,
the train's getting there. But there's other.
The good news is because the year before it was horrible news.
Sure.
Everything's relative. But thank you very much.
And unfortunately, somebody made a decision years ago to lump a lot of debt on the golf course that doesn't belong to the golf course. We just got to live with that now.
Right.
All right, thank you.
Okay.
Thanks, Ms. Kelly.
Dr. James.
It sounds like you enjoyed your golf outing and all of your.
I didn't get to play,
your
but it was, nice.
research
It was
and,
beautiful weather today.
Good job. Good job. Thanks.
Good.
Mark.
Good evening.
Hey, good evening, Doc.
Thank you for allowing me to talk about the health department and our responsibilities with you. And I speak on behalf of all the wonderful people that work with me. So as some of you know, actually I'm a father of 4, and I think that puts me in good company with both Dr. Whitaker and Mayor Wright. So tonight, I'm going to just start by saying, tonight when I go home, like every night, my kids at a minimum will want me to tell them a story, and they're going to want me to pray for them individually. And when I turn out the lights and I put my hands on them and I pray with them, I pray for the same 4 things every night. I pray that I thank God for giving them to us. I pray that they would become men and women of God. I pray that they would be safe. And the last thing I pray for is that they would be healthy. Mm-hmm. So I want you to take a moment just to reflect on this question. What kind of legacy do you want to leave your children, your grandchildren, your nieces and nephews, and the youth in Portsmouth? I suspect that many of our lists will be very similar. Things like a strong education, good friends, good financial foundation, living faith, and I think good health would be on that list as well. So today I wanted to talk to you about how, with your partnership, and together with our colleagues in the city manager's office, our friends in the civic leagues, our brothers and sisters in our faith communities, we can create a community health in Portsmouth, and how we can leave a legacy to our next generation. So as a scientist and a doctor, I hope you give me a pass for putting up a slide with a lot of numbers, but I promise you this is the only one that has decimals in it. So I want to start today by telling you the hard truth. So despite the heroic efforts of all the doctors and nurses in this area, every year in Portsmouth, 202 people die of cancer. 191 people die of heart disease. 40 people die of stroke. 38 people die of diabetes. 33 people die of unintentional injuries. Another 33 die of COPD and asthma. That's about 930 people who die every year in Portsmouth from these 6 different conditions. Every year in Portsmouth, more than 200 people should be living healthy, productive lives if I did a better job in creating healthier conditions in the city. And today I want to tell you how we can work together to reclaim those 200 lives. So we spend so much money in our country in healthcare. 17% of our gross domestic product. Medicaid is the largest line item in our state budget. Genetics is such a hot thing right now. President Obama just committed over $200 million this year to precision medicine. But genes and healthcare, they together only account for about 40% of how healthy we are. The other 60% is related to our behaviors, our social circumstances, and the environment. And we don't talk about this fact nearly enough. The zip code that you were born in, the zip code that you live in, that was going to determine how long you live and how healthy you are, more than any other factor, including your genes or the quality of the healthcare in the community. So performing CPR, resuscitating people in the ER is exciting. I get it. I love it. I work occasional shifts in the hospital. I love saving lives. Analyzing the human genome, that's really, really fascinating stuff. I get it. But where we can make a difference, where we can be different in Portsmouth, is empowering people to make healthy behavior choices, transforming people's social circumstances, and building a healthy environment for our citizens. So how do we get there? So we can build hospitals, insure more people, have doctors diagnose disease properly. We can put more people on medications to treat their disease. That's the health care and the medical model. We've tried that in America. Despite how much we pay in health care, we still don't get very good health outcomes. Another model is a public health model. In this model, we look at the whole community. We get good data on which communities are healthy and which are not. We ask residents, what would a healthy community look like? We bring together partners to help create plans to design a healthier community. We help support and assist communities so that everyone has an equal opportunity to live a healthy life. That's the public health model that we've been using as a blueprint for the last several years in Portsmouth that I've been here, and it's working. So what are public health interventions? Unlike a surgical procedure like my wife might do on you, or a medication that I might prescribe you, public health interventions are actually very hard to see. So let me give you a few examples. So this morning when I drove to work, I drove across the Jordan Bridge. I took Elm Avenue from the Naval Shipyard to the health department. So the health department, a few months ago, we reached out to the Naval Shipyard. We asked them, and several other large employers in the city, can we help you swap out some of your unhealthy items in your vending machines and put in healthier items? So I'm sure you've experienced a busy day, and you haven't gotten an opportunity to eat lunch until 2 o'clock. And then all that's left is sort of you go to this vending machine. And how can you live a healthy life if the things that you're choosing between are chips and Rice Krispie treats? So, but that's what Mr. Trotter and Ms. Little Hill in the Social Services Department have actually done. They've actually recently swapped out some of the unhealthy items and put in some healthy items in the vending machines. And that's a public health intervention. It's helping people make changing behaviors at little to no cost.
How are the sales going?
That is just in the last couple of weeks.
We've done it in City Hall, too.
So as I made my way up Elm around Prentice Place, I noticed that there were.
That's right.
So around, go ahead. I'm sorry. So around Prentice Place, I was starting to notice that there were really well-painted bike lanes in that area. So simply prompting people to exercise. Those are public health interventions. So our friends in the Department of Planning, Engineering, Public Works, you guys might not know it, but you are actually huge players in the public health system. And after going under the 264, you patch the splash park on the left. And that's where Mr. Palmerchuk and Mr. Folo are working with us to put up new signs and exercise equipment to promote walking in that walking trail. That's a public health intervention. And then the last thing I want to mention is across the street from the health department at Norcom, Dr. Patton just told me that she's working with Dr. Bracey to open up the track at Norcom so that community members in the area have a safe place where they can actually walk in the evenings. That's a public health intervention. So what I want you to take away from this slide, two things. First, that not all of you can be medical doctors and diagnose disease, but all of you can be public health professionals. And many of you already are. You just don't know it. Dr. Patton likes to talk about the 4,000 city employee eyes watching in Portsmouth. Use those eyes to diagnose what can be improved in our environment. You can't give out medications to make people start exercising, but you can, and you have the organizations you can represent now that can go mow a lawn in the back of your church so that people can walk in a grass field. Or you can take a 15-minute walk with your employees in the middle of a long meeting. That's the power of public health. Everyone can create public health interventions. And the second thing I want to bring up is that these interventions are typically free. They're cost effective. It takes some time, it takes some energy, some thought, some creativity, some planning to create healthier environments, but not necessarily a lot of money. Okay, so next slide. So speaking of money, I did want to provide an account to you what we do with your investment in us. And to go through all the list of services we provide would take the whole length of the presentation, so I'm just going to focus on 3 areas. First, we take care of moms and babies in Portsmouth. Moms and babies are particularly vulnerable. We've known this in the last 100 to 200 years. That's the population we really need to protect. So much recent research has suggested that childhood trauma in the first few years of life has a huge impact on health and how kids actually respond to stress later on in life. So we spend a large percentage of our resources in the health department to ensure our kids get a strong start through a variety of resources that's listed on the slide. Second, we're in the business of disease control. We make sure that you walk outside, that you're not going to be exposed to tuberculosis, provide a lot of immunizations. We run their travel clinics, so if you travel out of the country, you know how to protect yourself. Now when you come back, you're not exposing the people to diseases that might get out in Portsmouth. And the third thing is that we ensure that our environments are safe and clean. Make sure that when you walk down High Street and eat at a restaurant, you likely won't get food poisoning, or that during the summertime it's safe for you to swim in many of our public pools. So next slide. So I took a leadership class last year about strategy, and I read a quote that will always stick with me. It said, Martin Luther King never said, "I have a strategic plan." So the reality is that we work with limited resources. To be strategic in public health, we need to focus only on a few coherent strategies. If you remember, like 5 or 6 slides ago, I showed you the things that kill us. They're cancer, heart disease, stroke, diabetes, and lung disease. And these can all be linked back to 2 health behaviors. And what are they? Smoking and obesity. So these are the 2 things that we're really working on hard through the health department. So that's why we're working on smoke-free housing, closing the gap on diabetes, heart disease, and cancer rates through healthy eating, physical activity promotion, early diagnosis of diabetes and high blood pressure, utilizing community health workers. For the sake of time, I'm going to move on, but if you have any additional questions, you can contact me. We'd be happy to connect you with the team members that are working on these issues. So if you take anything away from this presentation, it's this slide. Who is part of the public health system? It's everyone listed on this slide and more. And members of City Council, you are vitally important because every policy you deliberate on has health impacts. They will either help to create a healthier Portsmouth or they won't. Please reach out to us at the Health Department. I hope you see us as a hub, connecting and aligning the work around health in our city, and as a resource to provide you with actionable data to support policy changes that will improve the health of our city. And I'll leave you with one last quote. Gandhi is quoted as saying, "It is health that is real wealth and not pieces of gold and silver." And I want you to think back to what I said in the very beginning. What are we praying for our children, our families, our communities? It's not wealth, but it's health. And I'd be happy to take any questions.
Good job, Doc. Let me ask you, I see your data here is from 2013, and I know we always, when we get together, we talk about our statistics in Portsmouth as compared to the state. How have we been comparing to ourselves over the last 5 years? Have our numbers got better at all?
Yeah, so one thing that we've talked about in the past is the county health rankings that's done by University of Wisconsin and Robert Wood Johnson Foundation. And they divide it into two things. Health factors, things that actually contribute to good health or bad health, and health outcomes, how well we're doing in terms of mortality and morbidity. And every year we are in the bottom 10, bottom 15% of the state. But one thing that we have noticed in the last 3 years, and it's not something I'm going to be tooting too much, is that we are starting to see our rankings go up. But as you know, health is something that is part of your environment. It's something that takes a very long time to change. So it's very easy for me to give you a drug and fix, whatever the problem is. But to create a very healthy person, it's the whole spectrum. It's educators, it's social services, it's folks, museums, it's parents, it's grandparents, it's faith communities. They're all part of the making somebody healthy.
So a slight uptick, but still in the bottom batch.
Yes.
Got it. Dr. Woodard.
In the city, we have high poverty, stress issues. How is that impacting these numbers that we're seeing?
Yeah, so there's been a lot of research in adverse childhood income outcomes. So from average childhood events that cause difficulty in adapting to stress and response later on as adults. And it's actually a neurologic issue. When you're constantly exposed as a child to stress, to abuse, to poverty, to issues related to poverty in terms of instability, housing instability, or food insecurity, your brain sort of just rewires, and it sees everything as a fight or flight response, and it makes it very hard for people to grow up and have ways to actually adapt to that. When something occurs, that individual most likely will respond in a way that may be actually not helpful for them. And actually they will turn, instead of being able to respond to that stress or that stressor, will turn to food or turn to drug addiction, something that will actually cause poor health instead of having the coping mechanisms to be able to handle that stress.
Yeah, I'm glad you mentioned it, because a lot of times we tend to just critique the school system instead of looking at the stress that these children are going through, that impacts on their brain development. Yes. And so as a council, when we start talking about things such as a livable wage, you're talking about changing some of the stress conditions in family lives. So I'm glad you brought that up. And I think that's a serious discussion, Dr. Patton, that the council, I've mentioned it several times, about the livable wage issue. It's not enough just to have jobs, but you have to have jobs where persons are being paid salaries that can support their families. And in our city, when you have these children who are moving from place to place, don't know where the next meal is going to come from, most of us in here, we don't have to deal with that situation, but it's impacting the kids. And so when I hear these criticisms of our school system, but yet we don't talk about trying to improve the environment, then I think that's an unfair assessment. And so I think this council, given the makeup of it, we need to seriously have that discussion on implementing a livable wage, and it's something that has been done in other cities. And so if there's no objection from council, at our next council meeting, can we start getting information on that and what we need to do from a legal standpoint to start moving toward. That's not something that's going to happen, I know, next year.
Right.
But we need to at least start moving the train in that direction.
We have started moving the train, our team, even finance, HR. We've been, in fact, we have had discussions and trying to determine just how we move forward, looking at city employees first. So we're having these discussions. We're not ready at this time to come back, but we can at least give you next time we come together update on what we're looking at broadly to impact city employees.
Well, and to Dr. Whitaker's point, to Dr. Chen, that the whole rationale behind us trying to do something with our recreational facility, the whole rationale for purchasing the old Pines and getting that up and running, those things are going to have significant impacts. They won't happen immediately, but they'll have significant impacts on our young kids, especially the ones that are living in high poverty areas. And you're right, we don't always tell the whole story, and we allow ourselves to get criticized for things like purchasing of that Pines and not realizing that the thing, once we get to where we ought to be and get the right monies programmed and the right after-school programs and all of these other things that help our schools, it's going to help us immensely. I'm just curious on how you're collecting that data of our kids. I mean, our poverty rate, our kids is around about 35%, I believe, here in Portsmouth. I think Portsmouth and Norfolk both around 35, 36%. And if you had to pick one thing, unfortunately you have to do that when you're in these tight economic environments. Is it a recreational component, Doc, that you would say we need to do? Is it getting healthy food trucks in some of our neighborhoods that don't normally have the fresh fruit and vegetables? I mean, if we had an extra $100,000 to do something now with, what would you, I mean, I'm putting you on the spot, but what would you, seriously, because, I mean, we talk about this, we talked about it at the mayor's conference with a lot of our urban cities, and a lot of kids don't even know where a lot of these fresh fruit and vegetables come from.
Right.
And we talked about these planting gardens and doing all of these things from an educational standpoint and from a health piece. And I mean, we often shoot a lot of those things down as they're silly or they doesn't make sense, but it's a huge difference in certain pockets in our community. I mean, I applaud what you do, but and being an engineer, you know, we love data. I like those decimals that you put up there, but how much and where should we go? I mean, because you need the income piece that Dr. Whitaker is talking about. You definitely need to have recreational facilities. You need programs that these kids will come and be a part of. If you just say it's a center or say it's a rec center, but it's nothing there to attract them, they're not coming. So you're wasting time. And the whole walking piece, the splash park you talked about, how do we have, I think we talked the other night about having some type of band, festivity, something over at the sportsplex to get the kids to start coming over to see what all the fuss is about, and then once you get them there, what are the healthier type programs and initiatives that we can kind of invoke or bring online. So I see us, Doc, using him and his department a lot, working in conjunction with Parks and Rec when it comes to getting that thing online. I mean, I still stand behind that purchase of that. That was a sweet deal. That was a sweet deal for this city. And the sooner we get the pieces in place to start utilizing that, the better it's going to help these kids here. And anyway, thanks for what you do. Yeah, I'm sorry, Dr. Whitaker.
Dr. Patton mentioned that you're looking at the city employees.
We were just looking at the livable wage.
Right. Can once again, no objection from council. Can we direct our city attorney to bring us back the legal information in regards to if that's implemented also at the private level, as well as the city? What
the ramifications?
What
I don't
we are
know.
legally.
Okay.
I don't know if we can do it, or does it have to go through the General Assembly, or that's a good question.
And one last question. Dr. Chang, do we have a food desert issue here in the city?
Yes.
Yeah, so food deserts are, there are a couple different sort of definitions, but both of them relate to low-income areas and low-access areas. And some say it's within 1 mile, and sometimes some say it's within half a mile. And it depends on if you're urban and rural. And we actually have a very nice map on our webpage for the health department where you can click on it. Our community health assessment actually has mapped out the areas that have food deserts in it that are both based on half a mile and 1 mile. So yes, the answer to your question, very long answer to your question, is yes. There are parts of Portsmouth that are food deserts.
Mayor, if I may, also, Dr. Whitaker, you gave us the Urban Leagues piece, which we're we'll be coming back with a report on. We've been looking at that, and we have a team working on that. But Dr. Chang and I meet one-on-one. He attends all of our department head meetings every 2 weeks, and he's very much engaged. We've had many conversations, shared things in regard to his concerns with school time start. Community gardens is a way to deal with food deserts. We didn't get as many community gardens as we want this summer, but we're going to continue to work that because you can put a garden in your backyard. It doesn't have to be a lot to get some of the healthier foods that you want. So we're working on that. But I wanted to go back to something that Dr. Whitaker said, and I think we missed it oftentimes. Transit children is a major problem within our city. And I don't think that we clearly understand. We can have all the recreation centers, we can have all the ball fields and everything, but if I don't know where I'm going to stay tonight, and I'm here with some friends, and tomorrow night I'm at somewhere else, just recently talking with one of my graduates from Norcom, and he just shared with me, and you know what the rules are if you go into public housing and you get caught and your name is not on the list. I mean, that's another whole piece that we need to work, and we are working on. In this one room is his grandmother, his mother, his sister, him, and uncle, and this is in one room in public housing. And when it's so many people who everybody that they know, they're living somewhere in public housing. So housing, and we can see just what happened a couple of weeks ago, how many people showed up to try to get a housing voucher. That's an issue, and I think we just working together look at all these issues that we at some point will have to tackle to change what our challenges are.
But connecting those dots, the schools and all of those
and we're
things.
working, the schools, the health, and us.
We talked this weekend over at the farmers market, actually the garden club. We did the inaugural ceremony for planting of those plants that they had to create more butterflies, and the garden club was there. It's probably about 30 seniors that were members of the club there, and I think it was Mook and Jordan were the two gentlemen that planted that. And I'd asked the garden club, had they thought about working and partnering with the schools and maybe doing something like a garden club in the elementary school levels. And so we actually kicked that conversation off Saturday, and where we go with that. I mean, but again, that's part of it, because you need all of these little pieces working together when it comes to...
No, thank you for asking the question. Like, what would I do with to change this? And I'll tell you what some other cities have done. Some cities have actually said the way that we're going to improve the health of our community is to focus all our resources on increasing high school graduation rates.
Yes.
There are other communities that have said the way that we're going to improve health in our communities is going to make sure every child has a safe place to stay at nighttime. So these issues are all linked together, and not to discount what I do, but the school system, economic development, job creation, housing, those are all vital importance of health. And for our city, I think what I would recommend is that with limited resources, like many other cities, probably the most important thing is getting everybody together and sort of aligning the work, because I know of so many wonderful organizations doing great things. PRHA, like going smoke-free a couple years ago. American Heart Association, going to PRHA facilities and doing cooking classes, healthy cooking demonstrations. So there's all this good work going on, but aligning that work and really focusing on a couple things to do that together. And that's a hard thing to do, right? To sort of utilize all the resources that we have to work on a few things. But I did want to make a pitch for Healthy Portsmouth, because I know you, Mayor, have been part of it. And Healthy Portsmouth is hopefully that agency that can bring together all these partners and to really start working together on some of these things.
That's the key, bringing the partners together.
See, just lastly, and I know you need to get to the virus piece of your presentation, but I'm thinking something even on a grander scale. You look at all of these abandoned houses that we have in our city and a lot of these cities. What would it cost us to purchase those homes? Okay, ma'am, I'm gonna ask you to leave if you keep disrupting us. One more time, please. What would something like that do if you align the dollars that we're spending and our redevelopment and housing, the things we're doing with social services and all of those pieces, just look at all of those dollars you have and couple that with lack of housing, kids. I think the school system told us with the transit kids, is it about 200 or 400? It's somewhere, that's a huge number. I mean, if you were to go and purchase a lot of these boarded up houses, I think you would come money ahead being able to do that, but you would have to sink all of those budgets in to be able to do that. I mean, I think we got opportunities staring in front of us, but it just takes some bold thinking and initiatives to be able to make the case and stick with it to overcome some of these pieces here, because the home is vitally important. If those stress points with a kid not having a place to stay, like you said, and the starting school later because the older kids need to stay home, they make sure the little kids get on the bus because the parents have to work. Those are things that we can't touch when it comes to putting it in a formula that tells whether or not the decisions we make, are they working, or should we have done something else? And so, just instead of just shooting in the dark, I'm thinking something a little bit more bolder. Yeah, I know that might not politically be the right thing to say, but if you're really interested in doing what you're saying and what you do in your business, I mean, that could be huge. Well, it could help what Dr. Whitaker is saying from the whole economics piece and
well, I'll share with you an example in Baltimore. Bon Secours Health System, which is also our hospital, we work very closely with them. And in Bon Secours in Baltimore, they actually, as a health intervention, they bought a bunch of houses that were vacant, and they actually bought them and demolished them as an act of and created new housing as a healthcare healthcare cost savings initiative. And it's if you read it, it's all over. You can read about it online. But really, they see that as a way to keep people out of the ER. And we have a very forward-thinking, compassionate health system in our city, and we've had really great relationships with them. I think that the city was interested in partnering in some way. I think that you have to think about your bottom line. They have to think about the bottom line. But I think both are very mission-oriented, and I'd be happy to make those connections.
Good point. Yeah,
I appreciate you bringing that out of the box type thinking, because we don't need to be conservative.
Right. It's got to be bold.
Dr. Chang, the stress issue and the neurological damage that you mentioned, is that reversible?
Adverse childhood experiences. I think that, I don't know. I think that there are probably ways that we can help people understand and how to manage those. But I don't know. I'm not the expert in that, so I'm not going to make a statement about that.
I was just curious, any research out there may have shown that that's reversible.
Our brains are very adaptive, so I would not be surprised if somehow we can change the circuits over our lifetime. But I think if we set our kids up, with a good, strong start, we don't have to face that.
Yes, sir.
Okay. All right, thank
If
you.
I could tie one
Yes,
thing.
ma'am.
Tonight on the city manager's report, council, you have CM item 16-183, which is the budget transfer for CSA fund. That ties directly into what we are talking about. The number of kids whose services are increasing as a result of the same issues that we're talking about. And by law, we are required to increase the portion when the federal or state monies have been used. This ties directly to it. We change these things, then we can begin to decrease those things that are impacting us with CSA and CMPT and social services and all of those services.
Okay. All right, Doc. The Zika virus.
All right. So thanks to my colleagues at Public Works and our staff. I speak on behalf of them. So I think Dr. Patton mentioned that there's a lot of confusion about Zika virus. In a recent phone survey, despite all the press that is going on with Zika virus, with Brazil and the Olympics, still about 2/3 of people say they know little or nothing about Zika virus. So the purpose of my presentation today is to present a few main points and then focus on what we can do as a city and then as an individuals to stop Zika virus transmission in Portsmouth. But I'm going to try to go quickly through the slides so that we have time for some questions. So to start out, let me list a few main points. Zika virus is spread to people primarily through the bite of infected mosquitoes, and this is a very mild disease. Only about 20% of people even notice any symptoms. 80% of people don't even notice. And that makes it sort of dangerous because you don't know if you have the disease. You may actually be passing to others. But for those who actually have any symptoms, those symptoms last about 2 to 7 days after being bitten, and they include like a rash, a joint pain, arthritis, or conjunctivitis, which is inflammation of the eyes. And given such a mild disease, why do we care about it? Because recently the CDC has confirmed that Zika virus can be spread from mother to child during pregnancy. And I talked about how important mothers and children are, and how vulnerable a time period is, and what has resulted from this transmission is a condition called microcephaly, or a very small head. In adults, Zika virus can also very rarely cause a disease called Guillain-Barré syndrome, and these are both diseases that affect the brain and affect the nervous system, and can result in things like problems with movement and balance, intellectual development, and seizures. And also recently, scientists have found that Zika virus can live in semen and can be transmitted through sexual contact. So there's no vaccine to prevent Zika, and there are no medicines to treat it. And that's why, if you take anything away from this talk, it's that in the battle against Zika, the war will be won in our backyards and also in your work sites. It won't be in the science lab or in the doctor's office. So the primary method of transmission of Zika virus is through the bite of an infected Aedes mosquito. And currently in Virginia, there are 25 imported cases of Zika virus. Some of these individuals are pregnant, and the Virginia Department of Health is tracking and monitoring all these cases. There's been no local transmission of Zika in the U.S. That means everyone who got Zika in the U.S. got it when they were traveling outside the continental United States. In the current outbreak in Brazil and South America, it's the Aedes aegypti, or the yellow fever mosquito, that appears to be the most efficient vector, meaning that they bite and actually cause most of the damage. But the Aedes albopictus, or the Asian tiger mosquito, is also capable of transmitting this virus. And these are the same mosquitoes that actually transmit and spread dengue or chikungunya. So these are other viruses that are actually spreading in the tropics as well. And these mosquitoes typically lay eggs in or near standing water in things like buckets, bowls, animal dishes, flower pots, and vases. And they prefer to bite people, and they live indoors. These are mosquitoes that like living indoors, living close to people. They're very aggressive daytime biters. They can also bite at night. Dr. Patton asked me, so I think, what do they do in the evenings? They're also biting in the evenings, but they like to bite at night in the daytime as well. but they are very wimpy flyers. And our George at Mosquito Control can tell you they usually only fly less than 150 feet. So in Portsmouth, we have George, who told me earlier today they have a department of about 3 people right now in mosquito control, and it's very limited resources, but they have 3 spray trucks, 9 spray routes, and weather permitting, they can take 3 nights to actually spray all their routes in the city. So the next 2 slides are the 2 most important. Every citizen can stop Zika virus by dressing appropriately in long sleeve shirts and pants. This is really boring stuff, right? But this is what actually makes a difference. And defending ourselves by staying indoors when we can't dress appropriately, using door screens, using appropriate insect repellent. And this is the graphic that we've actually created at the health department and are sharing in our community about the importance of dressing and defending. Now, one of the reasons why we think Zika spread so quickly in Brazil is that because people don't have access to air conditioning, or they may not have screens that work. There are so many people that crowd in the same area. So that's why we think that Zika virus will probably not transmit as effectively here in the U.S. So the next slide, please. As I mentioned, the mosquitoes that carry Zika like to live indoors near people. They live in these little standing pools of water, like even a thimble full of water around your home. So everything that you have that can hold any standing water, spill it, tip and toss it. As I said, they can't fly very far, and that's why the front lines of this battle against Zika is going to be in our homes. And you can eliminate this mosquito population by draining water, standing water in your homes, and doing all the things listed on this graphic. And by taking these actions, you can protect yourself, your family, and your neighbors from Zika virus. If you think about it, 150 feet is really not that far. And our state entomologist actually said recently, if you're out at night and you get bit by a mosquito, it's 95% chance it's the Asian tiger mosquito. And George, you can correct me if I'm wrong. And most likely, it actually it came from somewhere in your yard. You personally were able to actually prevent a lot of that. It's not the standing ponds of water or the puddles on the street. That's typically not where you're going to get the mosquitoes that are going to be causing these bites. So finally, we're working with the Department of Public Works, like I said, with Marketing and Communications and Tourism, Dana, to take actions to protect the public, and especially women of childbearing age, by doing education and outreach. The Virginia Department of Health gave us some Zika kits that include mosquito repellent, condoms, and education pamphlets, and we're giving them out to a lot of the women that we feel are at high risk, that are currently pregnant or thinking about becoming pregnant. We're educating our physicians, doing mosquito surveillance and mitigation, and communicating these messages we've developed to the public. And so if you go to the last slide, here's a list of links that you can go to, describe a little bit more about what we're doing and what the Zika virus is. Thanks for your attention. I'd be happy to take your questions.
Very good question.
Mayor, we've finished our presentations, but Mr. Ammons is prepared if you want him to come forward.
Okay.
Okay. Mayor, Vice Mayor, members of City Council, at our meeting on May 10th, I think, your request was for the city manager to move forward with the process through our procurement and purchasing office to go out for a request for proposals for waste management. Mr. Mike Ammons, purchasing administrator, will provide an update on the RFP for waste management. Mr. Ammons.
Good evening, Mayor Wright, Vice Mayor Simmons, members of council, citizens, Dr. Patton, staff. I'm here just to do an update on our RFP process that we put out for our municipal solid waste for the city of Portsmouth. We prepared a solicitation for disposal of the city of Portsmouth municipal solid waste and through the Office of Procurement Services. The solicitation was written from examples obtained from other jurisdictions around the Commonwealth, along with our waste management department. The RFP was published on May 18th in 2016 with a due date of June 1st, 2016. We posted solicitation on the city's website, which has a link to Demand Star, and also posted on the state's website, the Virginia Procurement website. The solicitation was sent to 15 vendors from Demand Star, and Eva sent it to 2,227 vendors. We received 2 responses to this RFP. Both proposals were evaluated and reviewed, and both were rejected in accordance with Article 5, Section 12-214 of the Portsmouth City Code.
Yes, Vice Mayor.
Can you tell me what that city code says? Why were they, they didn't have a T crossed, or what does that mean?
Portsmouth City Code allows the purchasing administrator, in the best interest of the city, to cancel or reject proposals when it's deemed to be in the best interest of the city.
What was the article again?
Article 5, Section 12-214.
Well,
Yeah, Dr. Wood.
why was it rejected in the best interest of the city?
According to the procurement law, I'm not allowed to release information on proposals. They're considered confidential.
You mean publicly?
Yes, sir.
So in a closed session, you can. Because you all can play around with this issue. We have a decision we have to make, and if we need to know whether a proposal is in the best interest of the city to go either with SIPSA or with a private vendor, and you're saying you can't disclose that information to us, and we're expected to vote?
No, sir. I said I can't dispose information to the public in a public session.
Okay, we can do
in
it.
accordance with
Because I asked you,
procurement
can we do it in a closed session, and you looked over there. I said,
I'm not able to answer that question.
is that going to be disclosed in a closed session?
He's rejected.
Dr. Whitaker, if the information, and of course with the Public Procurement Act, if the information is not, if the process doesn't go forward, if the process doesn't move forward, typically the record on a procurement is closed at that point in time.
That's not the question I asked. I asked because citizens been coming up here and speaking to us about this issue, and I think it's unacceptable for us to make a decision about whether we're going to go with a regional or with private without having information. I can't vote if I'm not informed. And so what aspect of the code, either an ordinance or state law, that prevents us from getting information on the proposals that were submitted?
Dr. Whitaker,
Session.
Dr. Whitaker, if you'd like an opinion or the council like a briefing in terms of legal with regard to that, we could certainly take that up in closed session.
Yeah. Okay. Yeah.
That'd be good.
Why don't we have a motion to go in the close, but we need to modify that. This motion does not cover the waste management piece, is that correct? No, it does not. Can we modify this so we can have some level of discussion? I'm inclined to agree with Dr. Whitaker. If we are not informed as to what these deficiencies are and whether or not it's something that could help us make a good judgment, I don't know how we can come to a conclusion at any time. But I don't want us in violation of a Procurement Act or code, and I also don't want us to set ourselves up for some type of public suit discussing private business, either publicly or in closed, if we cannot do that, Mr. Attorney. But we've got to be able to make a decision, and we cannot make a decision without getting the facts.
Mayor, I would suggest we consider a motion to discuss the Public Procurement Act, which is the issue at concern in closed session, and deal with legal counsel and legal advice. And I can provide you the motion.
As it,
Would you modify that? Can we do
Sorry.
that verbally, or do we need to?
I have a copy.
Okay, very good.
can we add,
Yes,
as
Dr. Whitaker.
it relates to the waste management?
As it relates to the waste management.
Yeah.
Because we don't need to just go in and discuss the Procurement Act.
No, that's
Maybe we
different.
So I'm saying
That's
that can't
different.
be the sole discussion.
Yeah, it's got a bridge over into what
Yeah.
we got to make it. What do we got here? The same thing?
I didn't say.
No, it's a third.
Oh,
It's
he
a
was
third.
prepared for that question.
Well,
Oh, wait.
should have just put it out here first.
You need another one? You
Okay.
got enough? Oh, pass it on.
This is
Just a revised.
Yes.
This is the new one.
Okay.
Okay. Yeah, that's it.
All right, somebody want to take us into close so we can try to start.
I move to go into closed meeting pursuant to Virginia. Thank you, Mr. Anderson. I move to go into closed meeting pursuant to Virginia Code Section 2.2-3711A7 for the purpose of consultation with legal counsel pertaining to an actual or probable litigation, where such consultation in open meeting would adversely affect the negotiating or litigating posture of the city, specifically regarding the City of Portsmouth versus South Norfolk Jordan Bridge, LLC, filed in the Portsmouth Circuit Court as case number CL 1500-2064-00 and 01. And pursuant to Virginia Code Section 2.2-3711A1 for the purpose of discussing and considering prospective candidates for and appointees to boards and commissions. And pursuant to Virginia Code Section 2.2-3711A7 for the purpose of consultation with legal counsel employed or retained by a public body regarding specific legal matters requiring the provision of legal advice specifically related to Article 5 of Chapter 12 of the Portsmouth City Code, Public Procurement.
Question.
Yeah, Dr. Wood.
Mr. Ashford, did you receive the email that I sent to you?
I did once I got in here, and my phone has been resetting, so I haven't. I just got it. I was with the mayor until about 5 minutes to 5.
Oh, okay.
And walked straight
See,
in.
that's something we just sent to him. Was it you sent to us or just sent to him?
It's sent to him to add a closed session item. It would be regarding personnel.
Excuse me.
You have you don't have your email there?
I don't. My phone is reset.
It's regarding the personnel issue that involves VRS. So there's a section of the code that needs to be added to discuss personnel.
I don't have that with me.
6 minutes.
Let me see. Give me 1 second.
Oh, you need time.
Yeah.
Do we need to do that tonight?
Yeah, that's not the code, sorry.
Give me a
Wait
code.
to the next meeting?
I don't think it'll be that long. It's not very long.
Why don't we just go ahead and add to discuss personnel matter dealing with VRS, Mr. Attorney?
2.2 3711A1. 2.2 3711A1.
Personnel matter.
Okay, can you amend your...
So amended.
So amended, okay? Is there a second?
Second.
Second. All right, Madam Clerk.
Yes, sir. Mr. Cherry?
Yes.
Dr. Edmonds?
Yes.
Mr. Meeks is absent. Mr. Moody is absent. Ms. Simmons?
Yeah.
Dr. Whitaker?
Yes.
Mayor Wright?
Yes.
We are in closed. Thank you.